Hello everyone, my name is Liuping Wang, and I'd like to present this research titled CASS towards building a social support chatbot for online health community. Chatbot systems have been increasingly adopted in many fields. However, most of these studies have inherent limitations. Many chatbot systems use a rule-based architecture, which makes the chatbot capable of understanding only a limited number of user inputs and responding with prescripted sentences, hindering its generalization. And most chatbots are deployed and tested only in single-user scenarios. But how these systems interacting with and impacting a group of users is understudied. In this paper, we aim to address this research gap by building and deploying a social support chatbot system, CASS, and evaluating its impact on the individuals who need social support as well as on the other members in the community. Motivated by existing literature that online communities often suffer low engagement from the members due to that many posts cannot get a timely response. Our chatbot's primary function is designed to engage in conversations with those unreplied social support needing posts. This study is exploratory in nature. The whole research project consists of 3 parts. Study 1 is an empirical exploration study to understand the context of the research site. To provide social support to this community, in Study 2, we built the CASS system. At last, in Study 3, CASS is deployed back to the community. In Study 1, the research site is one of the largest and most popular online health communities for pregnancy and parenting discussions in China. We conducted both descriptive statistic analysis and quantitative content analysis to understand the characteristics of support-seeking activities in this community. From the results, the users on this community posted 5,000 posts per day. However, approximately 18% of the posts did not receive any response. The interval time between the original post was published and the first response is 10 minutes. We used this number in Study 3 as a threshold to evaluate whether a post gets timely response after the deployment of our chatbot system. The content analysis of posts led to the identification of 11 concepts, which are grouped into 3 high-level categories, including informational support seeking, emotional support seeking, and sharing daily life. As shown in table, 45.95% of the posts were about seeking informational support. In Study 2, we propose a system architecture that works in the 5 steps. In Step 1, CASS collect and monitor new posts, then distinguish whether a post is timely replied. In Step 2, CASS classify posts into emotional support seeking category and informational support seeking category using a trained CNN model. The overall cross-validation accuracy of this model is 0.86 and F1 score is 0.87. In Step 3, CASS randomly dispatch half of the emotional support seeking posts into a control group and monitor them. In Step 4, CASS generates responses for posts in the experimental group using a trained LSTM model. To evaluate this model, we adopt automated performance evaluation. The BLEU score is 0.23, which is a fairly acceptable performance score. We also adopt human evaluation. The figure shows that AI response grammar correctness is rated high and not that different from human response. However, AI response quality is not as good as human response in topical relevance, willing to reply, and emotional support, suggesting that the chatbot should be improved on those dimensions. Despite the difference, all the evaluation scores are above 0. Then, in step 5, we designed a user interface console, which can be used by a human experimenter to track and monitor each AI-generated response in real time. Every response generated by the text generation model in step 4 will show up in the console for 10 seconds before being published to the community. During this time, the experimenter can type in new sentences in the console. But they didn't find any inappropriate AI-generated responses that need intervention. In study 3, we deployed the system and conducted the field experiment for 7 days. According to quantitative analysis, CASS functionality can help effectively mitigate the primary problem, where some posts cannot get a response in a timely manner, by reducing the number of posts with no response and speeding up the time that a post is responded. We also found that in the experiment condition, community members participate more actively in a post thread. Results also suggest that with the presence of our chatbot system, each post has a higher level of community participation, with both more people and more responses. According to the quantitative analysis of the emotional valence of the poster original posts and their first replies, our results showed that in the AI response group, more original support seekers revised and comment under their own posts to interact with other community members. In addition, more posters turn to a positive emotional valence, and less turn to negative emotion. In this sense, CASS can help individual members use their published post as an emotional outlet to chat with others, and may further improve their emotional status. Our work takes a different route, building a chatbot to act as an active member to boost the community engagement level. This result sounds similar to the catfish effect. An active catfish in a group of sardines in a fish tank can stimulate the sardines to be more active and live longer during the transition. Neural network-based chatbot can be a promising solution in this case, but it may be affected by the noisy label issue in training data. From data collection to response generation and publication, we employ rigorous methods to avoid the potential risk of such neural network-based chatbot architecture. An AI system with high accuracy is not enough. The AI system should also be designed to cooperate with the primary target users and the other users in the community. The human-AI collaboration future is the ultimate research goal that we are aiming for. Thank you for watching our presentation.